Okay. Well, my name is Jeannie Dudding, and I'm the Agriculture Extension Agent in Giles County. I appreciate everybody being here with us tonight. It looks like more folks are logging on as we get started. And so, again, just welcome. I hope everybody is staying safe during this time. And glad you could be here with us. Just a couple housekeeping items as we get started. We are going to keep everybody on mute except our panelists. This way it avoids any kind of background noise for everyone. If you have questions, there is a chat option on the very bottom of everybody's screen that you should see. And if you have a question for a panelist, you can go ahead and enter your question. Make sure that it is addressed to everyone so that we can see it if you enter a question in there. Sometimes you have options to direct questions to individual people or chats to individual people, and we just want to make sure that if you send it to everyone, then we can be sure to see your question and get an answer for you. So we will have each one of our panelists go through their talk, and then at the end of those 4 talks, we will open things up for folks to ask questions, and we'll try to address those questions in the chat. And at that point, if you want to try to unmute yourself to ask a question, we can try to handle things that way as well. So to give our panelists an introduction, we have with us Dr. Theresa or Tree Dellinger, and she is a diagnostician in the insect ID lab at Virginia Tech, and she works with insect taxonomy. Her background includes Met-Ved entomology, field crop IPM, and forest entomology, and she'll be sharing some information about the Asian longhorn tick itself and an update on that. Also with us is Dr. Tom Lavelle, who is the Southern Regional Veterinary Supervisor with the Virginia Department of Agriculture and Consumer Services, and he works out of the Wytheville office. Dr. Lavelle will share what VDACS role is with dealing with ATL and Theileria and their experiences from their field as well. Also with us is Dr. Lahmers, who is a clinical associate professor of anatomic pathology in the Department of Biomedical Sciences and Pathobiology at the Virginia Maryland College of Veterinary Medicine. He is going to focus his talk on Theileria and what we know about the disease and the tick that carries the disease. And then we have Dr. Currin, who is a clinical associate professor at the Virginia Maryland College of Veterinary Medicine, and he's going to discuss his experiences in the field with different cattle herds with the Theileria disease. So with that, I will turn it over to Dr. Dellinger to start our panel off.
All right, let me see if I can get this going. Share. Every time I do this, it's like new. Let's see here. Slideshow. Play from start. All right, can everybody see that?
Yep.
Okay. All right, well, thanks for having me tonight. My name is Dr. Tree Dellinger. I am a diagnostician in the Insect ID lab at Virginia Tech. And tonight I'm going to be going over some of the life history and biology of the Asian longhorn tick, along with some recommendations for protecting your cattle herd from these ticks. So we didn't know we had this tick before 2017. There was an owner of a sheep in New Jersey who had gone out to work with her sheep and realized that the sheep was covered with ticks, and then she realized she was covered with ticks. She contacted the health department, and they quickly realized this was an unusual situation given the number of ticks on her. So they went out to her property and treated the sheep and the property for ticks. They submitted samples of the ticks to the National Veterinary Service Lab for identification. And it came back as the Asian longhorn tick, which was not known to be present in the United States. It's native to Eastern China and Japan, Eastern Russia, and Korea. It has been invasive in Australia, New Zealand, and some of the Pacific Islands, but no one knew how this sheep had acquired these ticks. It had not traveled outside of the United States. it really hadn't left the property for some time, so it was a completely novel situation. So in January 2018, we received our first tick for identification in the lab, and we also sent it off to the National Veterinary Service Lab for confirmation. And it was confirmed as Asian Longhorn tick in May, and just a couple days later, we got another tick. So we realized that the tick was probably present in Virginia to some extent. The people in New Jersey had gone back to the property in in April, and they realized that the tick was still present and had successfully overwintered on the property. So in June 2018, on the map on the left, those red counties mark where the tick was known to be in Virginia and up in the New Jersey area. And the map on the right shows where we have the ticks in Virginia as of today. This is updated as of today. The USDA had just released their situational report this morning, so this is all up-to-date information. This is a map showing the ticks in the Mid-Atlantic region. The color counties just indicate where the ticks have been confirmed. The different colors indicate how they were identified, either molecular or taxonomic identification. You'll notice in the upper northwest county of Arkansas, there's one lone county that has the tick. They haven't been able to find it in the surrounding states or in the rest of Arkansas as of yet. There are 12 states that are known to have the tick as of now, and we're number one. We have the most counties in Virginia right now. I suspect that's probably going to change once people start getting out and doing more of their field research after the pandemic has lightened to some extent. So it'll be interesting to see what we find this summer in terms of where more ticks are found. They did go back and look at older tick specimens that had been collected, and people realized that this tick had been submitted before, but it was misidentified as a rabbit tick. There's a native species, a Haemaphysalis, that's known to be on rabbits. And we never expected Asian Longhorn tick to be here, so it was misidentified as the rabbit tick. That was on white-tailed deer in West Virginia in 2010, and then there was a sample from a dog in New Jersey in 2013. So clearly the tick has been present in the United States much longer than we expected. So recognizing the Asian Longhorn tick, this is a small reddish-brown nondescript tick. You can see the size comparison to a penny in the picture on the right. The tick has short-browed mouth parts, and the second palpal segment is flared out, giving it an angular shape. It doesn't have any distinctive markings on it like Lone Star tick or American dog tick. They're small. They're about 1/10 of an inch when unfed. This is photographs of scanning electron micrographs of the tick. You can see the angular portion of the mouth part as indicated by the tan arrow in the upper right. Those circles show the spurs that are found on the mouth parts, and those spurs or teeth are probably how it gets the name Longhorned. So what's different about this tick? Well, it's smaller size tick, so it's easily overlooked, especially if you've got a darker colored animal where that color just blends in. The females are parthenogenic. They can reproduce without mating. Males are known in the native populations in Asia, but it seems like the invasive populations in Australia, New Zealand, and here in the United States, males just are very infrequently found. I think there was one tick that was a male in the hundreds and hundreds of ticks that were found in New Jersey. So because it can reproduce as soon as it reaches adulthood, populations build up very quickly and can occur in large numbers in a smaller area. The tick spends most of its life off the host in the environment, probably about 80% of the time. It feeds on domesticated animals, wildlife, and humans, so including bears, deer, coyote, rabbits, raccoons and possums, and birds. And birds are an issue because if a female tick is on a bird and the bird flies off and lands in a new area, that female can establish a new population as soon as she reaches maturity because she can reproduce without mating. We know the tick survives well in our climate and environment, and most importantly for cattle producers, it is the suspected vector of Theileria in cattle. And I'm going to let my co-speakers discuss the disease. So some recommendations for protecting your animals. For the very least, you should regularly inspect your cattle for ticks whenever possible. I know that's not always easy. A lot of people have cattle out in the woods and they're pretty wary of getting around people. But if anytime you can get close to them, especially if they're in a chute, you should run your hand over the animal and look for ticks behind the ears, on the head, down the neck, flanks, armpits, groin, under the tail. These are small and they're hard to see, so it's almost easier to find them by touch. Certainly, if you're purchasing cattle, you should check those new cows before you add them to your herd. Any animals that look lethargic or just not doing very well should be suspect for ticks, and you should contact your vet to ask about potential disease. Animals with large number of ticks should be treated for the ticks, but animals with any amount of Asian longhorn tick present should be evaluated for the possibility of Theileria. Once Asian longhorn tick is found on your property, you should assume that it's established in the area and that managing it is going to be an ongoing process. We do have some chemical recommendations for ticks on cattle. Single application is probably not going to work with this particular species. We recommend you use a combination of ear tags with back rubbers and bullets. Just a reminder that not all ear tags are labeled for ticks. You should check the label. And also not all ear tags you can purchase online are registered for use in Virginia. Consider rotating your classes of pesticides to prevent or to slow the development of resistance by the Asian longhorn tick. Abamectin and beta-cyfluthrin ear tags are good choices. If you can, according to the label, tag both the adults and calves. Start using back rubbers and bullets again if you're not already. You can charge them with phosmet or permethrin. Cattle should contact these on a daily basis along the flanks and the head for best protection. You really want to put them up in some kind of pinch point situation where the cattle are forced to walk past them on a daily basis. Some producers will put these in front of a salt lick, but cattle don't go there every day, so they may not get their daily dose. You'll want to recharge these devices following the label, and keep in mind that Asian longhorn tick management may require recharging them every 2 to 3 weeks. So high risk periods for Theileria occur in February and March and August through October, but these ticks are active almost year round. We know they're active starting in February and they'll go all the way through into November. For animals with heavy or extreme tick densities, we recommend the use of porons along the top line. Keep in mind that you could have some cattle grub interactions, so check the labels for when those materials should be used and not used. If you have a heavy rain, it can wash off that material. So if you start seeing large numbers of flies on the animals after, well, the rain event we've had this week, go ahead and consider retreating. If you've got fly numbers building up, it's probably been washed off. Consult your vet about injectables, and we don't recommend pasture treatment unless you have severe densities of ticks present. Carbaryl can be labeled, or carbaryl labeled for pasture use should only be used on areas with the highest numbers of ticks, but don't rely on pasture treatments alone. You should use that in conjunction with other treatments. So just some reminders about general herd management. You want to go ahead and treat all animals at the same time. Mow and keep your pasture short because long grass and brush enhances tick survival. It gives them that extra humidity that they need to prevent desiccation. Mow your pasture short before you turn your cattle out, even if the cattle have been treated. And unfortunately, leaving your pastures ungrazed isn't going to make much of a difference with these ticks. Ticks can go a very long time without feeding. Also, any wildlife walking through those pastures can support tick populations while your cows are out of it. If possible, we recommend keeping your cattle out of wooded areas. If you have a fence line 20 feet away from a wooden line, that's ideal. I understand that's not always the case. If you have other domesticated animals on the property, go ahead and check them as well, particularly pets, small animals. And just as a reminder, check yourself for ticks when you're working in tick-infested areas. Asian longhorn tick is known to transmit some diseases in Asia. We haven't seen transmission of anything in the United States as of yet, but there was a recent paper that showed that these ticks are capable of transmitting Rocky Mountain spotted fever in the lab, at least. Certainly there are plenty of other tick species out there that do transmit some nasty things, so just, play it safe and check yourself as well. So what do you do if you do find a suspect tick? Well, collect some samples and put them in a bottle of alcohol, hand sanitizer. Scope will work, just something that of the tick until we can take a look at it. Submitting multiple samples is a good idea because some of them will have their mouth parts removed when you take them off the host or yourself. We use those mouth parts as part of the identification process, and that's why having a couple of ticks is a good idea. You can take your sample to your local cooperative extension agent, who will probably send it over to us at the Insect ID Lab for confirmation. We use a diagnosis request form with our samples. Please include any information you find that would help us, like how long you've been seeing these ticks, what kind of animal you found it on, how many ticks there are, anything like that would be useful. And just as a reminder that this is a free service, so we recommend everybody take advantage of it. And I'll wrap that up here. So let me see. Stop share. There we are. I have to talk myself through it in order to figure out where I'm at.
Okay, thank you, Tree.
Okay.
Dr. Lavelle, if you want to go ahead and pull up your screen. And I see that there is a question in the chat box from Jerry. And Jerry, we will get to that question, I believe, when we hear from Dr. Currin. So I see it, and we will get you an answer before the night's over. All right, Dr. Lavelle, we can see your screen, but you need to unmute your microphone. There you go.
All right. Can you hear me now?
Yes, sir. You are good.
Okay. I'm Tom Lavelle, and I work for the Virginia Department of Agriculture and Consumer Services. And I was just going to talk tonight about the Virginia Department of Agriculture's role in sort of the discovery of the tick and coordinating. A lot of these things that I had on my presentation, Tree has covered, so I'm going to skip over those fairly quickly. But let's see here. Just that it's a worldwide distribution, but it is native to Southeast Asia. I won't go into that anymore. She described the discovery in New Jersey on that sheep that was swarmed. And she also indicated that as we go along here that we've realized that the tick has been here a lot longer than 2017. And I guess the way Virginia got involved was with a beef producer up in Albemarle County that had lost 7 cows in August of 2017. And the practitioner ran several tests and kept coming up negative. It appeared like an anaplasmosis, and he did do a red blood cell smear with staining. And in that upper right-hand corner, you can see those are red blood cells with the protozoa Theileria inside it. So with any intraerythrocytic parasite or protozoa takes over the red blood cell, destroys it. So you do end up with clinical signs of anemia, such as weakness, jaundice, pale mucous membranes, trouble breathing, recumbency, and in some cases you can have death as well. It seems that even with the prevalence of the high positives within a herd, the death rate seems to be about 3 to 5%, if at all. And then there's some cows that seem to be asymptomatic. Skipping to the spring, the same producer found an orphan calf in the spring that had been bottle fed, covered in ticks. And that's when one of my counterpart up in Harrisonburg went out and ticks were collected and sent to NBSL. So we kind of came in the back door on the ticks. We found the Theileria first and then the tick second. And like Tree had said, there's multiple counties in Virginia that they currently have the Longhorn tick. She went over the characteristics of the tick, but the two big ones are that it's parthenogenic, no need for the male to be present for the female to produce eggs, enhancing her reproductive capabilities. And I guess one thing that really stands out is it swarms the host. And this is an example of swarming similar to the slide that Tree showed. You notice there's multiple ticks in that ear with varying degrees of engorgement. She also showed this slide here also, and I'd just like to reiterate that this line right through here is actually the I-81 corridor. So the tick has been very effective in hitching a ride. And if you go right down through here, this is the I-77 corridor. So it really has taken advantage of Virginia's interstate highways to make its presence or spread its presence in Virginia. And like she mentioned, we have not definitively associated the presence of the tick with Theileria, but this may change in the future with additional testing of tick populations. I'm just going to go over an example of a farm that we worked with last spring. And what's interesting, this particular property, the entomology department's been back out multiple times, and it seems to be a very good source of longhorn ticks. But going back last spring, this producer, their farm is actually split by I-77. And every spring they take their yearlings over to a spring pasture that hasn't had anything on it all winter. This particular pasture has no cattle bordering it. The interstate borders it on one side, there's woods on another side, and a housing development on the other. So on 5/1, they loaded up they Epernex pour on the cattle, load them up in a trailer, throw them around to the pasture. 2 weeks later, a steer had died. A local practitioner went out, necropsied the calf, brought a portion of the ear in that looked very similar to this. The next day, 2 of my inspectors and I and the local practitioner went out. We gathered the cattle up, and there were 32 yearlings in the group, I guess 31, but probably 85% of the ears looked like this, and that was just after 2 weeks of being in this pasture. So what we did that day is we did use a 5% permethrin pour-on, and we also bled a portion of the group for Theileria. Interesting enough, that first round of blood work was all negative for Theileria. We went back 3 weeks later just to recheck. What we found that many of these ticks, the ticks were just beginning to recolonize these ears. Many of them still weren't attached yet. Again, we rebled these cattle, and again, they came up negative. But at this point, we weren't sure if this was going to be an every 3-week treatment. But like Tree indicated, the ticks spend most of their life off the host. So we went ahead and retreated them with the permethrin pour-on, and the farmer set up a back rub, insecticide back rub. And for the rest of the summer, the cattle seemed to thrive. They gained well, and there were no longer any more infestations of the ears. or of the animals themselves. Not only were the ears affected, but it was along the brisket, on the inner sides of the rear legs, along the udder, scrotums, and that type of those type areas that are semi-protected. I did speak to this producer just this week. They turned their yearlings out a little bit earlier this year, and they ramped up their preventive measures. In addition to a Poron dewormer, they used the permethrin Poron. They put in insecticide ear tags, and they also set the back rubber up right away. It'll be 30 days tomorrow that the cattle that have been in this boundary, and he mentioned to me that they would see the occasional tick, but there's been no infestation or not very many are attached. So Tree did a great job going through some of the recommendations, and here's an instance where hopefully it really is going to work. But we're going to monitor it. And evidently this boundary must be a hotbed for the longhorn tick. Just in conclusion, I think people need to be aware that Virginia, you know, at the vet school, the entomology department, and with VDACS, we've all been very proactive on identifying the longhorn tick and the incidence of Theileria. One way that our office is helping is my livestock inspectors and those up in the Harrisonburg district are collecting blood samples at our livestock markets, trying to help us establish the prevalence of Theileria in Virginia. I mean, these samples all go to Dr. Lahmers' lab and are tested for Theileria and anaplasmosis. You know, down here in Southwest Virginia, many of our livestock markets are near borders, and we receive cattle from out of state. And this testing is illustrating that it's not just Virginia, but our surrounding states have Theileria as well. You know, currently there are no movement restrictions for Virginia cattle moving across state lines. We hope to keep it that way, but I guess it's a little bit of a two-edged sword with us promoting all this data that we have the ticks and this level of Theileria, so we need to be careful. We certainly don't want to hurt our Virginia feeder cattle market. I guess finally what we need to realize is the tick and Theileria are here to stay. I think the others are going to talk a lot more about the prevalence and how widespread it is. I think as producers, we need to be aware, institute tick control measures. You know, one frustrating point is that I don't think we fully understand what a positive means. It may not be showing any clinical signs. And what are the ethics of marketing these cattle? These are all questions that need to be answered. So that's all I have, and I guess we'll take questions at the end.
Okay, great. Thank you, Dr. Dr. Lahmers, are you still with us?
I am.
Perfect. Perfect. We can see your screen.
Excellent.
Thank you.
So I'm going to focus mainly on talking about Theileria orientalis. Dr. Lavelle mentioned that it was identified as Theileria orientalis. It wasn't until we looked further that we realized it was the Akita genotype, which is thought to be more of a problem. It's found in Asia, Australia, New Zealand, and has significant economic impacts in those areas. In those areas, it's been documented that it's been transmitted by Haemaphysalis longicornis, or the Asian longhorn tick. I will try to avoid having to say that again. But we haven't proven it here in the US. However, we have isolated Theileria orientalis Akita genotype out of Asian longhorn ticks from that farm, the initial farm in Albemarle County. And I'm working with folks at the USDA to do transmission studies to prove or disprove that tick is capable of transmitting Theileria. We talk about the tick, but it also has the potential to be transmitted by needles, biting flies, and potentially from mom to calf within the uterus. But those are thought to be far less common methods of transmission. Okay. So just about what we expect to see. Acute infection, meaning the first time they're exposed, they usually get sick, if they're going to get sick, within 1 to 8 weeks of after infection. After they are through that acute phase of infection, they are persistently infected for the rest of their lives. So they have it, but they don't show any clinical signs. There is the increased risk, hemolytic crisis, which means red blood cells would break apart and you'd get anemia. And that is most often occurs during periods of stress. So around calving, periods of high temperature, young calves, 1 to 3 month old calves, high temperature or a lack of water is also one that's we've seen in Virginia. So what do we know in Virginia? We have it, we've identified it in at least 25 counties in Virginia. The first 3 were Albemarle, Augusta, and Pulaski. But since that time, in working with VDACS, we've tested over 2,500 samples, and we've found it in 25 counties. In addition, we're working with West Virginia and have found it in 4 counties there, and are starting to work with neighboring states to do further investigation in those states. In this map, you can see the red is where we have both the Asian longhorn tick and Theileria. Orange is where we just have Theileria at the moment, not detected Theileria to this point. So as you can see, the Asian longhorn tick and Theileria have a pretty similar 77, and we have looked in the Shenandoah region and in Southwest Virginia, and we see it in about 3 to 5% of the animals. But this year we've seen a wider spread, and more of the animals are positive than last year. So we think it's expanding. We found multiple genotypes. The one we're worried about is Akita, but we found other ones. And then also we've looked at some farms that have had clinically ill animals. And on those farms, the majority of them, whenever we test the rest of the animals, we see that a large percentage of the animals are actually positive. Doesn't mean they're sick, but that means they have this organism. So recommendations, just consider Theileria as a potential cause of disease. There's been causes of disease before Theileria, and there will be pneumonia and pink eye after Theileria. But if you have clinical scenario that fits, i.e. you have anemia or weakness, icterus, unexpected death, late-term abortion, calf loss, all those things could potentially fall into for Theileria. One of the challenges with Theileria is we have really limited treatment options. Tetracyclines may or may not work. That's still not been proven. The only thing that's been proven to work is expensive and won't be available in the US because of really long withholding times, 18 months for animals that are treated, 9 months for calves that were born to treated cows. So it's probably not going to come here, probably not going to be approved. So really the main thing that we do is try to minimize stress, limit handling, good nutrition plan, access to water, all these things that you want to do for your cows anyhow. And consider if one's really struggling, pulling her out so that she doesn't have to fight for access to food or water. And so at this point, we're trying to control spread, and we're going with the assumption that the tick transmits. Again, the high risk times seem to coincide fairly nicely with when the tick is most active, but also it coincides with spring and fall calving. So is it ticks? Is it periods of stress? We've already talked about how to manage the tick. We should be moving to single-use needles for anaplasma and for Theileria. And also to think about the first clinical case, really, it is potentially a herd problem. So keep in mind that just because you have one sick, there may be more that are infected and more that could get sick. If you know you're in an endemic area, which here in the Southwest Virginia, we're starting to fit that criteria, we know we have it, you'd want to monitor new cattle and young calves because they are at risk because they would be naive and that would be their first exposure. And also, if you're trying to keep it out of the herd, consider the source of cattle that you bring into the herd, because they may potentially bring it into your herd. If you have the tick in the region, that could be a problem. So I just put contact information here. You don't necessarily need to do that. I would encourage you to work with your veterinarian to submit samples, but just in case you need to share that. And that's all I have. I'll pass it on to Dr. Currin.
Okay, Dr. Lahmers, thank you very much. Dr. Lahmers, Dr. Lavelle, and Dr. Tree, you've done a wonderful job of kind of talking about the Asian Longhorn tick and Theileria, and giving you a lot of good background and information there. I am going to provide you with some clinical cases and things that we've seen just to give you an example. Just a reminder, as Dr. Lahmers kind of alluded to, this is a new and emerging disease. What we know today is more than we knew 6 months ago and less than we'll know 6 months from now. So just keep that in mind. Some of the things that I'm going to tell you today, recommendations we're making currently, are different than the ones we made 3 or 6 months ago, and very well could be different than the ones we make in the future, much like you're seeing with our current coronavirus outbreak in this country and worldwide. Many of you have probably heard of the horror stories of lots of dead cows and that sort of thing, and Theileria being the cause of that. The good news is that those kind of situations where we have 2, 5, 6% of the cows die acutely over a short period of time do seem to be the very rare cases. That's bad if you're one of those herds that it happens to happen to, but the odds are, from all the information we have from other countries that this disease has occurred in, and also with what we've seen thus far in Virginia, is it looks like that will be by far the minority of the cases. The majority of the animals of the herds will become infected with this disease and show no clinical signs or just kind of minimal losses that are very minor on an ongoing basis. So Dr. Lahmers talked about the disease and then testing for disease. So what I wanted to go through is, what does a positive Theileria test mean, so that when you work with your veterinarian and think about testing for this disease and everything, you can have an idea. It could mean that the animal is infected with Theileria and suffering from clinical signs of disease, or has died from Theileria. If you're getting a sample out of the spleen or a blood sample and the animal proceeds on to die, that's certainly a possibility, and what we tend to think about as far as the disease. The animal is infected with Theileria and suffering clinical disease or death for another reason. So I'll run through an example of that, but it's certainly, just because we get a blood test that's positive for Theileria, because it's such prevalence in a lot of herds, does not mean that's the reason that that animal is sick. And so we need to, as Dr. Lahmers said, we need to be looking for signs of anemia and other clinical signs to help us believe that that is the case, rather than simply going to a blood test. And it could be that the animal is infected with Theileria and showing no clinical signs of disease. The vast majority of the animals that we test that come back positive for Theileria, we would not know that those animals were suffering from Theileria, or infected with Theileria, I should say, without the knowledge from that blood test. And it is certainly bad for those producers, and there have been some in Virginia that have had a small percentage of the cows that have acutely died in a short period of time from actual anemia and Theileria disease, like Dr. Lavelle said, looks clinically indistinguishable from anaplasmosis. For those of you that are joining us from southwestern part of the state of Virginia, we really don't think we have much of any anaplasmosis in Southwest Virginia. And so that's not a disease you've been used to seeing. Other parts of the state, Virginia is a area with areas where we don't tend to see anaplasmosis, and then we have areas where it's endemic or it's in those herds all the time, and we see those there. So we kind of have both of those going on in Virginia, but in Southwest Virginia, we don't tend to see clinical anaplasmosis. But this disease looks just like that and has all the clinical signs. Without a blood test, there would be no way for me to differentiate those, or your veterinarian to differentiate which of those diseases the animal had. Just to give you an example, we have a herd where we were doing surveillance for for Theileria, excuse me, and we sampled 50 of those cows in this 200 cow herd. 49 out of 50 of those animals that we randomly sampled tested positive for Theileria. So you can see that it does spread through a herd and become quite widespread in a herd very easily. The interesting thing with this herd is this herd had been under a 1 animal, 1 needle policy for 3 years prior to this testing. And so if it had come into this herd within that period of time, then it spread most likely, while Dr. Lahmers said it's not been proven, most likely through the tick. It's certainly located in the area where the tick has been located pretty readily. So we got all those cows that were positive in this herd. We had an animal that presented with staggering and possible weakness, and the owner said they had another cow present with similar clinical signs, and so we were concerned that perhaps we were having clinical Theileriosis, and so we asked that owner to bring that animal into the veterinary teaching hospital. This is one of the animals that had tested positive for Theileria on our original deal. On arrival, the appetite was fair, but its packed cell volume, its measure of its red blood cells, was 36%, which is in the normal range for the bovine. And so that would be indicative that we probably were not dealing with anything associated with Theileria. So we proceeded to go down in the next 48 hours and not be able to rise. Necropsy results found spinal lymphosarcoma in the spinal cord of the lumbar vertebrae, kind of lower, what would be the equivalent of the lower part of your back, right in front of our hips, that was causing a compression injury and her to be down on her and unable to use her hind limbs. So that's just a prime example of a case where, had we just taken a blood sample and said, okay, it's positive for Theileria, that's what's wrong with this animal, it's got Theileria, that would have been a case of a misdiagnosis of that particular animal. So just some limitations that we have. The testing is very good. The test is very accurate, but knowing what to do with the results when you have them is very important. So this herd has the same problems that your herds have and that existed in this herd before they ever got Theileria. And so it requires a good physical exam by yourself and or your veterinarian that you're working with to try to rule out other potential causes and to try to determine whether Theileria clinical signs exist on top of the positive test. So we tested all bulls at the Southwest Virginia BCA bull test on March the 3rd and retested them, all the negative bulls, on March the 26th. There was an ongoing, there were a couple of outbreaks of Theileria that were being reported in Southwest Virginia, and a lot of concern and questions about that. And so that led us to test the bulls there. So there were 121 bulls there on test. When we tested on March the 3rd, the first time, we bled those 121 bulls, and of those, 45 of those bulls tested positive for 37%. When Dr. Lahmers looked at these, based on the way the PCR test works and looking at blood smears. He determined that this looked to be a very acute infection that had just recently started in this group of animals. And so the thought was that there were likely other animals that would be positive and that were still becoming infected. And then there were some animals that had been infected, but long enough for that animals to be picked up. So we returned on March the 26th, right before the sale, the last time we were going to be able to get our hands on those animals, and retested the negative animals. So those 74 animals that were still negative and on the premises at that time, and 12 of those animals were positive for another 16%. So sure enough, Dr. Lahmers was correct, and we had an ongoing infection. And this is why those bulls then, for those of you that participated in the Southwest Virginia bull test deal, either as a purchaser or as a participant selling the bulls, this whole herd was sold as a positive herd and not individual animals, because we did not feel that we could accurately identify all the bulls that were positive at the time. The good news is none of these bulls were showing clinical signs of disease at the time they were tested, or any time up till sale day. None of them showed any of the clinical signs of theileriosis. As a matter of fact, the health on those bulls all the way through the test period for this past time frame was actually very good and better than average. Weight gains were directly in line with what the nutrition formulation said they should have been, and so therefore we were very happy with that. And I also can report that as of today, to the best of my knowledge, and talking to the consigners at the bull test station, Dr. Scott Greiner, who helps manage the bull test stations, there have been no reports of any problems with any of the herds that purchased these animals or any of the bulls that went home to the other herd. So some more evidence that the majority of this disease, the majority of the infections with this disease does not appear to cause significant clinical problems. So what did we learn? You can have an acute infection with Theileria in bulls, at least these yearling bulls, without causing any clinical health problems. And if you're dealing with a herd in an acute infection, being test negative for Theileria can be misleading because we could be having ongoing mixing of those, or ongoing infection of those animals from exposure, most likely to the tick, or other means to transfer blood from animal to animal, or animals that just had not been infected long enough to yet trigger a positive test. So what do we currently think we know about Theileria? As everybody said, it's a protozoan hemoparasite that is found in large chunks of Virginia and appears to be spreading rapidly through Virginia, and either is or likely will be through much of the mid-Atlantic in the near future. Most animals that are infected with Theileria do not show clinical signs of disease. Just like most of the cattle out there that have coccidia, another protozoan parasite that infects the GI tract, are just subclinically infected and do not show clinical signs of disease. Once you're introduced into a herd, Theileria does seem to spread through the herd fairly rapidly in a lot of cases until most of the herd is infected. As Dr. Lahmers said, currently it's believed that once infected with Theileria, the animals stay infected for life. And I will just reiterate what he said, there is no treatment for Theileria in the United States. Currently, our best recommendation is do everything possible to maintain the immune system, as you should be doing for this disease and other diseases anyway. Good protein, good energy, and mineral nutrition. Remember, we always talk about micromineral nutrition, but if we don't have the protein and energy levels adequate particularly in our cow herds, then it does not make a whole lot of difference probably what your selenium level, your copper and zinc levels. We tend to spend a lot of time focusing about talking on. There may be some advantage to buying Theileria positive animals for herds that are positive for Theileria and know they are already, and or in severely endemic areas, and will likely be positive in the short term because those animals probably have less chance of clinical disease. Bulls in the acute phase of disease may have decreased libido, but that would only be in the initial acute phase of disease, and they should very quickly do that. There's a small body of evidence to say that that's possibly the case. If you want to try to prolong the period of time or do everything you can to try to keep yourself from having Theileria introduced into your herd, then you need to do everything you can to avoid bringing new animals into the herd. You know, and or source Theileria negative animals. Quarantine and pour new arrivals with a pyrethroid pour-on, and 2 weeks later, pour them again before entering those into the herd to try to avoid bringing the Asian Longhorn tick into your herd. Having said that, those recommendations in and of themselves will help lower your risk, but there are many of these herds that Theileria has shown up in. We're already doing many of the important mitigation factors that we would recommend, and they've still had it come into their herd. So it looks to be that it will be very difficult to prevent this from going into herds. Where do we go from here? And I'll have a big warning there. These are best guesses. And that's all it is. I reserve the right to be completely wrong about this, but I'm going to give you what I think the most likely scenario is here. Most of the cattle in Virginia and the Mid-Atlantic will become positive for Theileria sometime in the next year, 3 years, 5 years, sometime. I think we'll see this disease or this exposure to this organism at least to be incredibly widespread based on how rapidly it appears to be spreading now. A few of the herds will suffer significant losses, while the vast majority of the herds will suffer very minor problems. What's going to happen with calves? That's a good question. Thus far, we've been able to document very minimal issues with calves and weaning stresses, those sort of things. My personal belief is the vast majority of the problems that we seem to be seeing in Virginia are related to adult cows in late gestation, potentially associated with the decrease in immune system function that goes along naturally with late pregnancy. If it were constrained to spring-born cattle, I would also throw in the nutritional issues that we face in Virginia with our spring-born cows and calves. However, given the fact that we tend to see it about that same time frame in fall-born cows, and in reality, those cows are generally in a very good body condition score and a good plan of nutrition in September, October range, and so that sort of makes that part of the argument much less likely and makes it more likely to do something with the immune system. With that, I'm finished up. I think I'm the last person to go, and I'll turn it back over to Jeannie and let her take any questions. I think there was one question, Jeannie, you said about the long range and the use of insect growth regulators with regards to the tick.
Yeah,
Okay.
IGRs added to minerals and the injectable long range. Do they have any impact on controlling the ticks?
Okay, IGR, while good for flies, probably has no activity on the tick for a couple of reasons. One would be exposure. The reason it works so well with flies is it passes through into the manure, and then the horned fly in particular does pretty much exclusively all of its egg laying in that manure pat, and to some extent the face fly. And so that's where it impacts those. And so we would not expect that. The ivermectin type compounds, of which long range is one. Long Range does not have a label claim for ticks, but they have shown some activity against ticks, and you probably do get some benefit from using those, although that would be that is not on the label itself.
Okay, then our next question in the chat box is, of the control recommendation, one of the control recommendations was to mow pasture short. How short?
Short enough to work. That's a recommendation that I haven't actually seen an exact measurement on what height the grass should be when you're done. The idea is that you need to lower the height of the grass so that you can get increased airflow around the ground level, increased sunlight exposure. So that means the ticks are more prone to desiccation, but I can't tell you an exact height that it should be at. So you don't want to scalp the pasture, of course, but certainly knock it back some to get some of that airflow and sunlight down there to make it harder for the ticks to survive.
Okay, great. The next question is, how do you treat other mammalian species effectively to reduce ticks and reduce the vectors spreading the Asian longhorn tick and Theileria?
Oh, that's a good question too. Obviously, if it's a domesticated animal like a cat and dog, then you'd follow your veterinarian's recommendations for flea and tick control. For wildlife, I'm not really sure if we have any sort of guidelines for treating wild animals. I think there's a lot of possible ways that could go wrong, and then the overall expense and time effort of trying to treat all the other mammals on your property, I don't think that would be a good technique for managing the tick.
Okay. Dr. Currin, I would say to you, or Dr. Lavelle, would a fly curtain be as effective as a back rub? I'm assuming they mean with treating with the pyrethrins.
I think anything is going to help, especially if you have regular contact time with the animal. But I don't think we know enough really yet how to control it. And these discussions are very good. And like I've said before at some of these meetings, we like to hear what the producers are doing. If there's anything that they seem to be doing that's working on their particular farms, we're very open to hearing it and disseminating that information.
The really interesting thing is there seems to be some sort of predilection that this tick really likes certain areas. Dr. Jillian, another one of our tick experts, is doing a lot of surveillance stuff and trying to learn a lot about the epidemiology of this tick and where it likes. I did the meeting with the North Carolina folks, and you know, nobody around that farm in North Carolina that had the problems had any issues. And so it seemed to be confined to that one farm, which is very strange given how many ticks there were supposedly found on those cattle and everything, that not another single producer around there even really found any ticks on their cattle or noticed any issues with their cattle and everything. And so, you know, that's kind of a interesting thing as far as that goes. But, you know, I think it's important that we all make sure we have this problem. One of the things that concerns me is using too much of things like pour-on ivermectins, generics, like we're doing with fly control and those sorts of things, and applying too much of these products could lead to us to having issues that we're not counting on as far as resistance to either the tick itself or in other ways, either flies for our pyrethrins and organophosphates, or the worms in the cases of the ivermectin type compound. So I think it's important that, you look to see if you had a problem, as Dr. Tree said, and try to identify that, because it appears that you can have an issue really bad in one spot, and even in close proximity to that spot, not have an issue at all.
Just to follow up on that, John, what's interesting is the tick has not shown up at the main farm in this Wythe County farm, which is just across the interstate. So, Tree, I know folks from your department have been out there. Do you have any ideas why that particular boundary is so conducive to the longhorn tick population?
No, unfortunately, I haven't had a recent chance to catch up with Jillian and her technician to discuss that property. So I don't really have an answer for that.
Just to add in about the tick, it tends to be, they like to use the term hyperendemic. It sits in clusters of hundreds to thousands. And so you can drag for ticks and then move over 5 yards and go from 0 ticks to several hundred ticks. So some of that may just be bad luck where those clusters are.
Jeannie, I
Okay.
see that Clay Childs has talked about, he clarified that he was asking about domesticated animals. And I know that we use porons for horses for tick control. I know there are materials also available for goats and sheep, but I'm not as familiar with that. Do our animal vet guys have recommendations for those other animals?
You would need to, there are pyrethrins approved for most of those species, or work with your veterinarian to use them in an extra label manner. Certainly horses have pyrethrins approved for them. They are commonly used in goats and sheep. I'm struggling right now to remember if any of the poron pyrethroids actually have a label for goats and sheep, but work with your veterinarian on the use of those. Along those same lines, Alan Heichman had asked about organophosphates. Dr. Tree did mention organophosphates as one of the potential things to put in back rubbers. Of course, organophosphates are those people that are old like myself remember Warbeck's as our big organophosphate that we used to apply to cattle and that sort of thing. Currently, we have fly tags that have organophosphates in them and Coral that can be applied to face things and that sort of thing. And Dr. Tree, you mentioned those, and you want to comment on those as a potential?
Yes, I mean, if there's something about ticks on the label, then it could be appropriate for use. I know with horse people, they often use the wipe-on type sprays as well. I'm just not as familiar with the small ruminants.
So,
Okay. The next question is ivermectin poron effective?
it should have some activity, yes.
Okay. And Alan, if we didn't answer your question, type in there unless you're satisfied with the answer that you've got. Another participant, Johnny Hunt, shared that they have started using an automatic sprayer that is activated when cattle walk through to get water, and that it seems to be highly effective thus far in helping control ticks. So I think he was just sharing that for the good of the group to let us know what's working for them.
Yeah, I think, utilization of multiple control deals will be important for that, whether it be things like that. Dr. Tree mentioned lots of different options. To Alan's comment of pyrethrins and macrocyclic lactones and organophosphates. I think it will take multiple control issues and an integrated pest management approach, just like it does with fly control, relying only on a single type of compound or method of doing things probably will not, if somebody has a bad problem, will probably not be enough. That's why I think it's very important to work with your local extension agent, your veterinarian, the experts from the tick and entomology department, Dr. Lahmers, and other experts from extension to do that. Dr. Nathaniel Burke has just texted me to let me know that synergized D-lice is labeled for sheep, and so you can do that. And then people are using frontline spray in horses, in addition to the pyrethrin type wipes that are approved for horses. And so work with your veterinarian to do that.
Okay. Next question we have in the chat box is, how often would you suggest rotating classes of treatments to avoid resistance?
Well, you could rotate, use one product for a while and then switch over to another. Each time you apply ear tags, or you recharge your devices like the bullets, or once you've run out that bottle. The main thing with this tick is that it doesn't have to mate in order to reproduce, and therefore it can populations can build up very quickly. And the idea of rotating these classes of pesticides is really to avoid that resistance development. So that's our main concern, and that's why we've offered a number of recommendations of materials and delivery methods for this tick.
Anybody else, anything to add to that? Okay, if anybody would like to unmute themselves and ask a question, we invite you to do that right now as well. As of right now, our chat box is empty, but just to give anybody a final chance to jump in and ask a question, I'll take a minute just to, again, thank our panelists and thank Dr. Greiner and Dr. Currin for helping me put the program together tonight. And let you all know that we did record tonight's session, so if anybody is interested in revisiting this topic or knows of somebody who would have liked to have been on the call, we do have that recorded, and it'll be posted to the Beef Extension website through the Animal and Poultry Science Department. I did also want to let you guys know that the second and fourth Fridays of each month, the Beef Extension group is doing a livestock update. Tomorrow is our next installment of that program. We will have Mike Carpenter and William Morris from the Virginia Livestock to give us a Virginia livestock market update. We'll also have Dr. White talk about livestock enterprise management, key financial considerations. If you've never heard Dr. White, I highly recommend tuning in tomorrow to hear him talk. We will also have summer pasture and forage management discussion with Gabe Pint, who is the farm manager up at the Steele's Tavern ARAC at the Cyrus McCormick Farm. And so that takes place tomorrow at noon. And if you'd like some more information on that, you can reach out to your extension agent or myself or Dr. Greiner for help locating that Zoom. There are also several recorded sessions, different webinars on the Beef Extension website, so I encourage you to visit that site as well. And it looks like we do have another question here in the chat box, and the question is there a group listserv email we can join to get notifications? Dr. Greiner, I'm going to bounce that to you.
Yes, Jeannie, we have Extension website, we do have a beef listserv, and you should be able to sign up there.
Okay. Also, Dr. Platt, I have a Facebook page. It's the Giles County Agricultural Extension Facebook page, and I try to put everything up on there as well. I'm not sure where you are located, but your local extension agent should also have access to the different webinars that are being put out by VCE. Because not only do we have livestock related webinars, but there's been several that agents are doing on gardening and stress management, you know, pasture management, weed control. There's been a lot of different webinars bouncing around. So your local extension agent should be able to help direct you to those, or, you know, reach out to myself or Dr. Greiner and we can help you too. So there's another question in here from Corey. If we rotate controls and use often and heavily, can't we run into problems similar to internal parasites and small ruminants?
I think that's a very good question. That's part of the reason that I said that we really truly need a good diagnosis and understanding if we have this problem, rather than just a blanket deal for people going out and treating, you know, just because they've heard of it or read the article about this terrible tick that killed 5 cows in Surrey County, North Carolina, that made the runs on the internet this past winter. So, you know, that's a tough call, Corey. Those recommendations have changed so many times with specifically regards to dewormers in small ruminants and cattle in particular, as far as changing every time, changing every year, changing, using them until they quit working and then changing, that I really start to question whether we have a good handle on it. But I think proper use in working with your veterinarian extension agent and identifying A, that you have a problem, and B, coming up with an integrated plan specific to that farm is what we really need to focus on. And why, you know, the guidelines that you've gotten here tonight from all of us provide a good framework, but what works on each individual farm will be quite a bit different. My fly control program is different on almost every farm that I work with, based on all the factors that go into it.
Okay. I think that's the last question so far that I see in the chat box. I did put the website for the extension, for the beef extension website in the chat box, so that everybody should be able to see that. If you want to visit that website, it is there for you to do so. So do we have any other questions for our panelists? Okay. Well, I think, Dr. Greiner, unless you've got anything else to add, I think we can wrap it up there for the evening.
I do not, Jeannie. Thanks for everybody's attendance. And thanks.
Yep.
Thanks for having us.
Yep, ditto that. And of course, if you guys have any other questions for any of the participants, if there are any other timely topics that you think you could benefit from a webinar, because clearly we can't meet in person right now, but if there's anything else that you could benefit from, I encourage you to reach out to any of us that were on the panel, or myself or Dr. Greiner, or your local extension agent, if there's anything you can benefit from extension that we can offer for you. I hope everybody stays safe during this very unique time. And I thank you for being here tonight, and thanks again to our panelists.
Thank you for organizing, Jeannie.
Yeah, thank you.
No, no problem. It was a team effort.